Assalamu alaikum. Our today's topic for MCQs is to understand the background concepts, uses, and basic measurements of epidemiology, morbidity, mortality, disability, and fertility. First question. A public health officer is analyzing data from a community where 500 people developed a disease out of a population of 10,000 over the past year. Which of the following best represents the measure being calculated? A. Mortality rate. B. Case fatality rate. C. Prevalence rate. D. Incidence rate. E. Disability adjusted life years. The correct answer is D. Incidence rate. Question 2. In a study on road traffic accidents, two cities report the same number of fatalities. However, City A had 10,000 RTAs while City B had 2,000. Which measure should be used to determine which city had a more severe outcome of accidents? A. Incidence rate. B. Disability prevalence. C. Case fatality rate. D. Crude mortality rate. E. Proportional mortality ratio. The correct answer is C. Case fatality rate. Question 3. A physician wants to understand the burden of a chronic disabling condition in a population. Which of the following matrix would most appropriately help her quantify this? A. Crude death rate. B. Disability adjusted life years. C. Case fatality rate. D. Attack rate. E. Specific mortality rate. Correct answer B. Disability adjusted life years. Next question. A region reports that out of every 1,000 live births, 60 infants die before their first birthday. Which type of epidemiological measure is being described? A. Infant mortality rate. B. Neonatal mortality rate. C. Perinatal mortality rate. D. Under 5 mortality rate. E. Maternal mortality ratio. Correct answer is A. Infant mortality rate. Next question. A chronic disease has low incidence but high prevalence in a population. What can be inferred from this information? A. The disease causes high mortality soon after diagnosis. B. The population is immune to the disease. C. The disease has a long duration or slow recovery. D. There is high case fatality. E. The disease affects only children. Correct answer is C. The disease has a long duration or slow recovery. Question 6. During a national health survey, it was found that region had the highest mortality rate due to cardiovascular diseases. However, this region also had the oldest population. What is the most appropriate method to allow fair comparison of mortality rates between regions? A. Use case fatality rates instead. B. Adjust rates for age, which is age standardization. C. Compare raw number of deaths. D. Use only DLY as a measure. E. Ignore age and compare as is. Correct answer is B. Adjust rates for age. Question 7. In a population of 100,000, there were 5,000 people with diabetes at a specific point in time. What does this measure represent? A. Incidence rate. B. Point prevalence. C. Period prevalence. D. Attack rate. E. Crude death rate. Correct answer is B. Point prevalence. Next question. In a population of 50,000, a total of 1,000 people have been diagnosed with cancer over the last 5 years. What does this value represent? Point prevalence. B. Period prevalence. C. Incidence rate. D. Crude mortality rate. E. Case fatality rate. The correct answer is B. Period prevalence. Next question. Two diseases have the same incidence in a population, but one has a much higher case fatality rate. What conclusion can be drawn? A. Both diseases are equally severe. B. The disease has higher fertility. The disease with higher fertility is more lethal. C. The population has equal immunity to both diseases. D. Incidence is a better measure of disease burden than fertility. E. Both diseases have equal impact on DLYs. Correct answer is B. The disease with higher fertility is more lethal. Last question. A country aims to reduce its maternal mortality ratio by improving antenatal and emergency care. Which of the following changes would most directly impact this goal? A. Increase in the number of hospital beds. B. Reduction in the number of stillbirths. C. Decrease in deaths per 100,000 live births. D. Increase in infant survival beyond 1 year. E. Reduction in congenital anomalies. Correct answer is C. Decrease in deaths per 100,000 live births. Thank you.